Morning. It's lovely to be here, and this is fulfilling a lifetime ambition of mine to be in two places at once. So thank you, thank you for that. And yes, a month into my new role at the Arts Council of Wales as head of their Arts, Health and Wellbeing team. And I can honestly say it's been an absolute pleasure, and I think it's such a privilege to work at the Arts Council of Wales, and particularly in this team as well. I think the work that's gone before me in terms of setting the arts, health and wellbeing sector up in Wales for success has been absolutely phenomenal from the Arts Council. I think I really ride on the coattails of my predecessor, Sally, who spent years, literally years, building up amazing partnerships with health partners in the sector, really getting a good amount of funding into this space from the Arts Council's budget, and doing all of that kind of really deep development work to make sure that this funding has is making a difference. And so I feel hugely privileged to be able to pick up on that mantle from Sally. And it's a fantastic sector to work in. It's a fantastic country to work in. And so I can't be anything but excited and happy to be in the role. It's been very busy. So we've had a number of what we call decision meetings, where we've been making decisions about funding based on the applications that have come into us, including in the Arts, Health and Wellbeing Lottery Fund, which is our biggest funding that we give to the sector. So we've paid out 11 grants over the past couple of weeks in that. And so that's been a really great learning experience for me, just to work out not just how our processes work, but think about the types of applications that we're getting, the types of health challenges that we're meeting, and the partners that we're working with as well. So that's been fantastic. And that really does create a lot of momentum for the work as well, in terms of who we're supporting and the new work that's coming through, as well as the sort of grants that we're giving to later stage projects that have already done their testing and are looking to scale. Priorities, I think, for the sector are still continuing to tell the story of this work in a really impactful and accessible way that starts to make this work feel like it's not just nice to have. I mean, it is nice to have. I sort of have a bit of an issue sometimes with that word, because I think what's wrong with having things that are nice to have? We need them. They're really, really important. But I think that everyone understands what I mean by that. That this work is not just at the fringes of the arts sector. It's not just at the fringes of the health sector. It's core to both of the well-being and the effectiveness of both of those worlds. So I think just continuing to tell that story, and I don't think it's always easy. I think it relies on having resource to tell that story well, and it also relies on having evidence. So that's something that I'm really, really interested in this work, is evidence, because I think there is so much already. And I think that, but I don't know if the sector really always knows how to use what's out there already. But also I do think there are places where we still need to build the evidence base. And it's interesting for me to think about, well, why isn't that happening, and why aren't we getting more research funding into Wales, for example? And is that something that needs to come from the Arts Council, or does it come from elsewhere? So I'm thinking about all those kind of big picture things, but also we still have priorities around making sure that our workforce is representative and inclusive. So really proud to be working with Wahoon on the Stepping In programme, and thinking about how that kind of work can be scaled up as well, and making sure that we get enough applications from all parts of Wales, representing all communities as well. That feels really, really important in this role. I would love for everyone who works in this field to feel as though that momentum is there behind their work, and also that security. I do think that I've worked in this space for getting on 15 years now, and this is actually the first permanent job I've had for over 10 years. And I think that does speak to the kind of nature of this work. It still is a little on the fringes. It is still a bit project to project. And I think all of us working in this space have been incredibly resourceful and incredibly dedicated. Um, but I think that in itself can't be sustained long term. And I think that lots of progress has been made in this area in terms of helping people who work in this space to feel like it is a proper work area and that it is secure and that it is that projects can have a lifespan beyond just one period of funding. So I think that there's still lots to do there. My hope for the future is that we just continue to build on that. I would also love to see even more recognition for Wales beyond our borders, so UK and internationally. I think being able to shout more about what we do and really get that spotlight that we deserve. And I think that will really help people here to take notice, the politicians and the health leaders to take notice of what everyone is doing in this space.